Do you know some of the ways in which you can manage a relative with kidney disease who is at home? Welcome to our platform, our dear viewers. I am a physician, Dr. Andrew, to take you through. And if you're new to this page, kindly subscribe so that you continue receiving our videos to help you improve your health. Today we are going to talk about one of our colleagues who has a mother who has kidney disease and she's at home and is wondering, how can I manage my mother who is at home with kidney disease? So we are going to see some of the ways in which you can assist a relative or a loved one who has kidney disease to control their disease while at home. Number one, and very important, blood pressure control. So your relative who is at home or loved one who is at home and has kidney disease must have a blood pressure which is within the normal ranges as told by your physician. So to make sure this is possible, you have to constantly monitor the blood pressure of your loved one. These days we have digital blood pressure machines which anyone can buy and have in their home, and this can help you to monitor your blood pressure every day and even take a recording so that when you go to visit your physician, you show them the recording and they recommend treatment according to what is going on. And this will enable the kidney patient to have proper blood pressure control, which will reduce the progression of kidney disease. Number two, we have blood sugar. Blood sugar is another important aspect of kidney disease management in two ways. One, you could have gotten kidney disease as a result of blood sugar or diabetes. So it is important for you to have your diabetes controlled, for you to have your blood sugar within the normal ranges so that your kidney disease does not progress. Number two, patients who have severe kidney disease, what we call end-stage kidney disease, reach a level where their body can no longer handle blood sugar and they get hypoglycemia, or in other words, their blood sugar drops to very low levels which can be dangerous for their health. So when such a time comes, it is important to monitor the blood sugar of your kidney patient, so make sure they don't get to that. How can you do this? By having a self-monitoring blood glucose glucometer at home, which you can use and take a recording. Then you need to also work with the healthcare teams so that your patient gets regular checkups, and this includes taking this patient or your loved one to the physician for daily reviews, for constant reviews, so that they are kept updated regarding their health and so that the doctor can keep checking, and whenever there is something coming up, it can be detected early and managed appropriately. Medicines. Avoid giving this kidney patient any medicines over the counter. You want to make sure all the medicine given is prescribed. You want to avoid herbal concoctions whose composition is not known. And all the medicines given should be as directed by your physician or your healthcare provider. Number six, you want to make sure this patient is getting good physical activity, because physical activity is essential for patients with kidney disease. Yes, they might be very sick and weak, but they can do light activity, and this will help to reduce their disease progression. Then you want to make sure they get a dietitian to help them with their meal plan, to have the best kind of diet with the best nutrition, a well-balanced diet, avoiding all the foods that are detrimental to the kidneys. And as we have been saying in our earlier videos, which you can catch up with from our page, foods which are less in phosphorus or phosphate, potassium and sodium. These are the foods that are good for your kidney patient. And it is your role as a helper at home to get your kidney patient a nutritionist, a dietitian, to help them come up with a meal plan and feed healthy. Then you have to also assist your kidney patient at home regarding their weight. You want them to have their weight which is within the normal range, appropriate weight. Overweight, as we said, is bad for your kidneys because it can lead to worsening of your kidney disease. And also underweight is not good. So you need to have a healthy and normal weight. You need to ensure that your patient who has kidney disease gets enough sleep. Remember, we said with kidney disease, retention of toxins in your body can be harmful to the brain. So you want to make sure your patient gets good brain health. And one of the ways of having a healthy brain is having enough sleep. So this will also protect them from some of the complications like encephalopathy, or a brain which does not function well because of the kidney disease. Then you want to make sure your kidney disease patient or loved one quits dangerous lifestyles like smoking, and engaging in consumption of alcohol, because these will be detrimental to your health and they will even further worsen or lead to further progression of the kidney disease. So these are things which you have to avoid and make sure your patient avoids. Even at home, if there are any people who are smoking, just know that your patient can also inhale the smoke via passive smoking. So you want to avoid all that and have a home which has a healthy environment. Then you have to help and support them. These kidney disease patients have a lot of depression. They feel bad because, as we all know, kidney disease is a continuously progressing disease. And some of these patients have reached a stage we call end-stage kidney disease and they are on palliative care.